Cancer, which is the development of abnormal cells that divide uncontrollably and have the ability to destroy the normal body tissue, has been said to be the second leading cause of death in the world. Nwanne Ogechukwu tells us more in this commentary.
Cancer refers to any one of a large number of diseases characterized by the development of abnormal cells that divide uncontrollably and have the ability to infiltrate and destroy normal body tissue.
Cancer is generally an abnormal growth when anything becomes uncontrollable, when it's growing, so to speak. And not only just growing, because you can have something that is growing that is not cancer. So it's not every growth that is cancer.
It is not one disease. It's actually a group of over 200 different distinct genomic diseases that share certain characteristics. One is a non-purposeful growth, which is uncontrollable. And two, it is a non-stoppable process. It is the refusal of the body to be able to control these cells. All cells of the body can have cancer. Every human being can have cancer. Any age can be afflicted by cancer.
Some of the most common signs and symptoms of cancer, although every case is different. Some general signs and symptoms of cancer include weight loss, loss of appetite, cough, or indigestion, among others.
It's not possible to know you have cancer. Even I, as I'm sitting here, I can't know. But I can know the warning signs. It spells the word caution.
Cancer that affects cells of the blood can be said to be cancer of the blood, okay? And as you know, there are the major cells in the blood are the red cells, the white cells, and the platelets, okay? But when we talk about blood cancer, mainly what is commonly known is the cancer of the white blood cells, which sometimes we call leukemia and sometimes lymphoma and myeloma.
Each type of blood cancer is different, but they can share some common symptoms and signs. Some people may not have symptoms until the disease is advanced, or sometimes the symptoms may be mistaken for a severe cold or fluid.
Unfortunately, the symptoms for blood cancers are almost like the symptoms of malaria. So a lot of times, a lot of our patients come in late and then get the history that we've been having fever, malaria, a few body pains and all that for about 2-3 months. But they had been treating for malaria, or in the more common parlance, malaria and typhoid. So what happens is that they get the treatment, the temporary relief, and then they fall ill again. So that keeps happening several times.
Patients with cancer of the blood come late to the hospital for treatment because either they've been misdiagnosed or they were not even thinking of that in that treatment. Patients should be investigated properly. Resources are limited, and so that can be a challenge also for the doctor who is attending to this patient. The basics should be done by trying to investigate this patient properly and on time, rather than treating for something over and over. Patient is there with you 1 week, 2 weeks, 3 weeks, is not getting better. And then by the time you are referring the patient one has exhausted all his resources.
Then it becomes advisable to listen to your body, maintain a healthy lifestyle, and go for a regular check. Cancer is not a death sentence.
Cancer is not a death sentence. Seek treatment early. Please do yourself a favor and make sure at least once a year you and your loved ones go out for a medical checkup.
Listen to your body. Give and take. The body would have given you a sign, but you either choose to ignore it or you assumed it wasn't important. So listen to your body. Do your yearly exams, your pap smears, your PSAs, colonoscopy, and seek conventional medicine.
We can actually prevent cancer, and where it is not preventable, we can actually take care of it early enough. But what we find is that most people come in what we call stage 4, when the cancer has spread to all the parts of the body, and there's hardly anything you can do other than say, okay, just palliative care, relieve pain and make the person a little bit comfortable until the time the person dies. Can be prevented by regular checkup, by changing risky behavior or changing lifestyle that predisposes to, ill health or cancer.
Nwanne Ogechukwu, ACNN News.